I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. Today, I have with me a dear friend and colleague, Diane Moore. She is the Executive Director of the Developmental Disabilities Nurses Association. Welcome to the podcast, Diane.
Thank you. Thank you so much, Craig. It's a pleasure.
So I like to start off just, learning about how people got into this field. So tell me about how you started in this field.
Well, I find just working with nurses in general who practice in the specialty of IDD nursing, most of us, I think, kind of got into this by accident. There are some that have had some exposure, in either a family situation or were able to be involved maybe with a Special Olympics program or something that kind of developed the passion early on and sought this out. But most of us kind of landed here by accident. And for me, it was quite the same. I went through nursing school, and unfortunately, as is still the case with nursing schools in most areas of healthcare education, very little to no exposure to persons with IDD. So I came out and kind of went the traditional in a way. Did ICU, CCU, I loved that, and did 12-hour shifts. I had young children at the time, and the shift work got to be a little bit burdensome. So I was really looking for something that could better accommodate my family needs. And I had a friend who was working at a children's facility for children with IDD. And she said, well, we don't have a nursing position open, but we actually have a program supervisor position open. Would you be interested in that? So when I got into the field of IDD, I actually came in from that programming side rather than nursing. She abandoned me shortly thereafter and took a facility director job at another facility across town. And she had been there a couple of days and felt compelled to make a change in her director of nursing position. And so she contacted me and said, before I do anything about this concern, would you come and be my DON? And I did. When I walked into the children's facility, and I say this all the time, I actually was planning not to pursue something other than ICU. But when I walked into that facility, as cliche as it may sound, I kind of fell in love and just never left. In a figurative sense.
We've talked about this before. It's one of these fields where very quickly if it's for you or if it's not. And if it is for you, it kind of grabs you and doesn't let go.
Exactly.
Yeah.
Exactly.
Yeah.
Yeah.
So we're going to talk a little bit more about DDNA in a minute, but I know that you have some other responsibilities. We'll just say that. Talk about your other activities outside of this association.
I went to work for this large provider, and then I was approached about working in a more extended setting in small group settings, and so I took a position there, and ultimately ended up being a very large company. We were acquired a couple of different times, and so we grew, and so I had a really large area of geographically, and also a number of clients and fairly large nursing staff, and it required me to travel considerably. So after the third time we were purchased, I felt like the new company may not have had the same values that I had, and so I approached one of my colleagues at the time, and I said, why don't we try to do something locally? And so we purchased a provider agency in my hometown, and so I co-own a provider agency for people with IDD in community-based settings, both small residential settings and in-home support, day habilitation, et cetera. So what
a calling, a tremendous amount of responsibility, a big workload as well, but I'm sure there's some rewards in there too.
Of course. I always say you don't find yourself in this area of work, whether you're working at a nursing level or an administrative level or direct support level, if you're here and you stay here, you're not here to get rich. You're here because, as you said, it kind of grabs you, it hooks you, and if it's for you, you're here for the individuals. And that was really my business partners and my focus was, we're not business people first. Our focus and our mission is to support the people that choose to receive services from us, and so tremendous responsibility. But the rewards are there every day, and if you talk to someone in the field, that's oftentimes what you hear. That what a rewarding area of just the population, the people with whom you get to work, and from a nursing perspective, I will say this, that I think one of the most rewarding things about this area of nursing practice is you can work in a lot of different areas of nursing, and obviously, and you can impact the person's life maybe in the moment, or if you're in a traditional acute care setting, you're there for the shift or the 2 or 3, and then the person's gone, and beyond that, you don't have any real impact. You don't even have contact with the person. But in the IDD world, very often you have the privilege of working with someone over an extended period of time, and as you know, Craig, it tends to be a very vulnerable population, and so one of the key roles for us is advocacy, advocating for the individual to receive the care that they need, or to which they should be entitled. Sometimes advocating for the individual with the family who may have a different idea about what they want to have happen. Advocating
that can be challenging.
It can.
Yes.
So it is an area of nursing practice where I've certainly mentored a number of nurses over the years, and I've heard that more than once. That the reason it's so rewarding is honestly you get to make a difference in someone's life in a way that you can't really do in any other area of nursing practice.
And it requires, in addition to nursing skills, it really requires a lot of people skills.
It does.
Yeah. Being able to relate to people in different ways, being able to recognize nuances in terms of the way people's, little changes can mean a big difference in this field. And
Absolutely.
So using your skills of observation, there's a lot of, you really get to use what you learned both in school and in life.
Yes.
In this field. And you tend to build I think we tend to build relationships with people that we provide services for that are unlike many other fields. They get to be very close and very rewarding relationships.
Absolutely.
Yeah. So would you say it's a great field for nurses to consider? Absolutely.
And the real sad part about that is unless you happen to have some personal connection with someone who has IDD, odds are you won't even realize this area of nursing practice exists. I hear that all the time.
Or medical practice, or PT,
Absolutely.
Or anything else.
Dentistry, any of that.
And that's actually one of the reasons we're doing this, because
Yes.
we want to get the word out to everyone about this field for many different reasons. The more awareness, the more understanding can build momentum to create greater improvements than we've already seen in this field, which we know there's probably still some room for improvement in some areas.
Absolutely.
But also that it's a place where people can have a career and can come and use all of their skills and different skills and put them to use in a very rewarding way.
Right.
Yeah.
Yeah, and I think sometimes in nursing, and I don't know if you hear this in medicine so much, but in nursing sometimes people view this area of nursing a couple of different ways. They either view it as, okay, that's not really nursing any longer.
I knew that's where you were going with that.
Right.
Yeah.
Or, okay, they must do that kind of nursing because they're not qualified to do another kind of nursing. And to your point, as you know, as a clinician, you use all of your skills that you learned, and both during your healthcare training curriculum, whatever that might have been, and then everything you've learned in your practice of what some of those subtleties that you mentioned, and then some. So it's an area that really requires you to come with a good deal of skills. You really do need to have strong clinical skills, and then you have to have great people skills and good instinct. You have to really hone those observational skills and pick up on those subtleties.
Pull the word out of my mouth. Observational skills.
Yeah.
One of the things I learned to do. So often in this field, you're asked to see someone because they're just not acting right.
Right.
And that's pretty much all the information you get. It's like, so what do you do with that? And what I would do many times is I would just pull up a chair and I'd just sit there.
Mm-hmm. Exactly.
And just watch and look for subtle changes and little differences that I could tell was different than that person was before. And that oftentimes really gave me tons of information, where sometimes in medicine, we don't have time to do that when you're seeing 20 or 30 patients a day in an office, and we lose that. And this really is an opportunity to almost go back to that bedside medicine in some ways.
Absolutely.
Yeah, and use all of those the old-time bedside manner skills, I guess, for lack of a better term.
Right.
So speaking of nursing and nursing in this field, tell us more about the Developmental Disabilities Nurses Association. Maybe, a little bit about how it came about, what its goals are, what its mission is, and what you do.
Yeah. Well, the Developmental Disabilities Nurses Association was incorporated in 1992, and it really was a grassroots effort, honestly, that resulted in you had these smaller kind of local networks of nurses trying to serve as a resource to one another. Because unlike today, kind of back in the 90s, there was very little information about, there's a little more today, but there was very little in terms of education about IDD or IDD nursing. How do you do this? When a lot of times I've been doing this long enough that I say, no, I didn't reinvent the wheel. I mean, I invented the wheel, okay? Because there weren't those resources available, right?
Yeah.
So
they pick up pieces and build
absolutely build it. Yes, exactly.
Yeah.
And so you had these nurses who recognized very early on that we kind of have to stick together. We have to serve as a resource to one another. So you had someone to call to say, have you ever encountered this? Do you have a system of how you address this particular issue or whatever? So you had these several local networks across primarily the Northeast, and specifically the New York Association, the New York DD Nurses Association. They were a little bit larger group, and they actually gave DDNA its seed money to start the National Association, because what they realized was if we're struggling here, nurses everywhere are going to be struggling for the same thing. So out of that was born DDNA. And so we're just in the middle of our 31st annual education conference, as you know, and that certainly is one of our key roles. We feel that providing good quality education is still critical to the practicing IDD nurse. And our mission is really to advocate for nurses in this specialty, because with the changing dynamic that you see kind of socially and how services are managed, or the goal for how they're managed in these more and more, increasingly extended settings, a lot of times advocating for nurses and nursing to still have a presence in the lives of people with IDD, is particularly where that is necessary, but where the individual wants that person involved as well. And it's to educate. Again, education is key. I think none of us can be the practitioner we need to be if we don't have the education first and foremost. And we really want our nurses to come away feeling empowered to do their job. And if you've been to a number of DDNA conferences, but it's an incredibly powerful thing to sit in a room full of other healthcare professionals who know what it takes to do what you do every day. And I tell nurses you don't get that anywhere but DDNA. But to be able to sit there and know the person next to you faces the same challenges you face, has the same questions. And oftentimes another challenge for IDD nursing, especially in some of the more rural areas, or especially with some of your smaller provider agencies, oftentimes you'll have a nurse who's working in isolation. So it's not, you don't have this office where you can walk down the hall to say, what do you think about this? Or do you think I'm have you got any ideas on how we need to approach this? And so they work very much in isolation. So they come here and we try to make resources available to them, and we try to help them connect with other nurses somewhere in the same area so that they can do some of that networking when it's necessary outside of DDNA.
That is so important and so valuable to the people that work in this field, and I can relate to that so well. The first time I went to the AADMD conference, American Academy of Developmental Medicine and Dentistry conference, and I realized for the first time that there were other physicians in the same boat that had the same experiences. I really felt like I was the only person out there doing this, and I was the least smart person in the world because I didn't really have the training, and had learned it all the hard way. And I was like, how come this is so difficult? I'm not say difficult, but it's just different. And recognizing that there was a group out there that had similar experiences made me feel certainly a lot better, but also provided so many opportunities for growth and education and just camaraderie and people I can call if I have a question about something I don't understand. And that is so important and so valuable. And you're right, a lot of nurses as well are working very isolated, maybe with a particular organization or in a rural area, and they don't have that network. So that's another great part of this organization. Now, I know that you provide certification, right? And there's two different levels of certification.
We have certification for nurses, and we have two different certifications depending on the nurse's licensure. We're one of the few areas of nursing practice that actually offer certification for nurses who practice at the licensed practical nurse or licensed vocational nurse level. And so we do have a certification for nurses who are LPNs or LVNs, depending on the state in which you work. The title may be a bit different. And then we have certification for your registered professional nurses as well. We feel that certification is another one of those pillars that really serve as a foundation for IDD nursing across the country. It indicates, first of all, the person is required to have a good deal of experience working in the specialty of IDD nursing, so that if someone were to employ a nurse who was certified in the specialty, they would know that they're getting a nurse that's got extensive experience, a high degree of expertise, and beyond that, a real commitment to the people that we support. Because certification is not required in a lot of places. It's taken years for certification to be required in some other areas of nursing practice. And so we're just not there yet with IDD nursing. That's our goal, obviously, is we think it's critical that nurses who have experience are working with people with IDD. That's one of the real challenges, oftentimes at the provider level and the administrator level or the owner level, depending, is that oftentimes those folks don't understand and really what an experienced IDD nurse brings to the table. And they tend to think that a nurse is a nurse is a nurse, and they don't recognize the difference. And they also tend to look at nursing, particularly in these extended settings where we're trying to make everything kind of community-based, and all the reasons behind that are great. So there's not a question about that. But they tend to look at nursing as a real task-oriented kind of profession where we come in and we complete a certain task and then we leave, we exit. We administer a medication, or we come in and do delegation, which is kind of a strange way to say that, but that's right.
Podcast issue.
Yeah, exactly, a whole other one. But they don't understand kind of what they're missing, which is what an experienced IDD nurse brings, and nurses serve a much broader role and certainly should be used in a much broader sense.
Including teaching and education.
Absolutely critical. Because we're, the direct support professional, those are the people who are primarily responsible for the day-to-day care for the individual. And that is increasingly the case, no matter whether you're talking about a community-based program or a structured setting. And how can we expect them to provide the care and support the person needs if they're not educated on what they need? So it's a critical piece of IDD nursing.
So I want to pivot back to your other role as a provider owner.
Sure. Uh-huh.
And, there may be people out there that have a thought or an interest in becoming a provider agency or becoming a provider of services for people with intellectual and developmental disabilities. Do you have any advice, tips, warnings?
The first thing I guess I would say is it will test your commitment, not to the people that you support, I find. That's never a question for me or my business partner. We are as committed today to the people we support as we were the day we decided to open the doors. And probably more so because they've, as you know, when you serve someone over a period of time, we have individuals that we've been serving for for over 20 years. And so they become more, there's a much deeper relationship that you have with a person that you've known for 20 years, as opposed to someone that you might have only known for a few days or a few weeks.
And that's true of all of us, right? Our
Absolutely.
friends that are 20-year-old friends.
Exactly.
We know them
exactly
pretty intimately.
So, so the question of commitment, if you're truly looking to do this, and assuming that you're not under any illusion about accumulating any great wealth, because that won't happen, particularly in today's market.
Yeah.
So assuming that you're motivated properly, the commitment to the individuals is not the question. The commitment to the daily grind, and truthfully, especially with the funding issues that I think we're facing, and I think that's a nationwide issue. But the disparity, the funding creates such a disparity in what we're able to pay for direct support professionals, who can go to other jobs and make significantly more money than we're able to pay. And again, so if you have a DSP, a direct support professional, who's been there for any length of time, I can promise you they're not there for the money. They're there for the individual. So the commitment, be prepared to be committed for the long haul. And understand that there are challenges, there are regulatory changes, over time, and there are additions to the regulatory requirements, even though you're confident that they could not possibly require more of you than they do. So that happens. But yeah, that would be the one thing that I would say: be prepared for that. The workforce challenges that providers are facing right now is unprecedented, and I don't have any solutions to offer, so I hesitate to bring up an issue that I can't really offer a solution. But I will say that again, if you can find a core group of people, obviously how we treat people is paramount, I think, in staff retention. People have to make enough money to survive, but money for people who are working in this field, money is not number one. They have to have enough to take care of their family or their own needs, but how they're treated and how flexible you can be and how creative you can be in terms of offering them a way to continue to keep this particular position, trying to be flexible. Those are things, because that's a real challenge. Real challenge these days.
Someone told me this once many years ago, or very early in my career when I had tons and tons of debt, and they said, people don't work for money.
Right.
And I'm like, I'm here because I got bills to pay. I'm working for money. And I didn't get it because I was not in a position to understand what they were really talking about.
Right.
We work for money, but we can work in many different environments.
Right.
We have a particular job or a career usually because there's some connection or some emotion or some fulfillment that we get from it. Mm-hmm. And I can say, and I think you can agree, that this might be a place you might not make millions, right, but you certainly can find fulfillment in this job. And it can be a career, not just a job.
Yeah, I think that's absolutely true. And I think we get paid in a whole lot of different ways. Money just being one of them.
I love that.
Yeah, so I walk away every day just, either feeling great that I was able to, help someone get through an issue or find a connection to address an issue they've got, or just sit down and have a cup of coffee with a person that I've had the pleasure and honor to serve for 20 years. And that payment you don't get at McDonald's or JCPenney. Yeah, right, right, exactly.
So we're coming to a point here where I'm going to do a little play sort of a little game.
Oh,
so I'm
Lord.
going to take out
you didn't tell me there was a game.
Yeah, there's no prizes though, but you can't lose either. So
then there's
I guess
hope.
you can call it a game.
There's hope for me.
So I guess you can call it a game. I call it 3 and 3.
Okay.
All right. So you have 3 minutes to tell us 3 things that you think people out there can do, people can work towards to improve the general world of health, wellness, support services, really anything. It can be anything you can think of that people can put a little energy into, that can make a difference in this field, that can grow this field, that can have a positive impact in the lives of people with IDD. Okay, ready?
I'm ready.
Go.
I think. Well, I would start. I think there are, too numerous to mention, honestly, and that's not because I'm, some expert necessarily in IDD. But the first thing that I would say is we have to get disability, and specifically IDD disability education, in the healthcare curricula across this country, across nursing, medicine, dentistry. Occupational therapy probably gets more exposure to IDD than any other healthcare profession because so much of that is kind of helping the individual have deal with kind of the disability on a longer term basis. So that I would say would start to improve the care that people receive. I think legislatively there has to be a look at how are people supported. And what is the funding that you're going to provide? Someone, said something to me one time about, having to take care of other people and how we spend our tax dollars. And I said, the thing about this is we take care of people who can't care for themselves because of our humanity. And I think it's important that we don't forget that. So there are more efficient ways to provide services than we provide in a lot of situations, but legislatively there has to be some funding to provide for the care of the individuals that we support. I think also, I guess the third thing I would say is, and we've made great strides in this, but I think a lot of people don't understand the percentage of the population that deal with some disability. And I was speaking with a colleague yesterday, and she said, it's amazing because not only do you not get any introduction to IDD, intellectual and developmental disabilities, in your healthcare curricula, you get very little of any kind of disability. And about 25% of the population, so a quarter of the population, have some sort of disability, progressive or,
Any of us can fall into that at
Absolutely.
Any time.
Absolutely.
In the blink of an eye.
Yeah. So I think there has to continue to be, some way to increase the society's awareness of that so that we can all be more sensitive to that, and I think that's important, obviously, but so that we're prepared to interact with, include people. We talk about, inclusion, and, it started out with integration, and I always try to make sure people understand the distinction. Integration has to do with geography, okay? Inclusion, to me, has to do with relationships. It has to do with, I'm included in my community because I have a relationship with the people who are there. I'm a part of, and people, I serve a role. And I think a human need for all of us is to be a contributing member of our society at whatever level we can contribute. And I think that's why meaningful inclusion in the community is so critical for people with disabilities of all kinds, and certainly people with intellectual and developmental disabilities. And so helping kind of begin to address that socially, I think, is important. And it certainly begins to kind of tear away at the social stigma that's been so attached to people with IDD all this time.
Well, those are some wonderful suggestions and thoughts, and I'm sure you probably have many more. And we'll probably tap into them at another time.
Okay.
So,
okay, great.
Anything else you'd like to say? Anything else you'd like to add?
Well, I first of all, I so appreciate the opportunity to just visit with you today. And Craig, you and I've known each other for a number of years, and I certainly appreciate all that you've done in the specialty of IDD. I think that again, it's always such an honor to meet with and visit with and get to know another person who works in the specialty at whatever level. Because it's that you just almost always can guarantee that's a good soul, I think that we all have to support one another. You and I were chatting a little bit earlier about AADMD, the American Academy of Developmental Medicine and Dentistry, and they're kind of a sister association, if you will. We've walked the walk together for a while. But again, I think the more that we can collaborate with one another, the more that we can support efforts to increase that education. I know AADMD is certainly working on that. That's certainly on DDNA's agenda. That's an effort that we're really going to try to put some work behind in the not too distant future, and just begin trying to make some of those inroads to those areas. And I think that we could certainly use the public's help if they're so inclined.
Sure, use your influence.
Absolutely.
And you have influence.
Yes.
In different areas.
Absolutely.
You certainly know legislators who can work with laws. You certainly know state officials. You can advocate for this field and people in this field. Health equity. We all really deserve the opportunity or ability to receive a basic level of competent health care anywhere we go, regardless of any disability status or not. And right now, I would say that for people with disabilities, they don't necessarily have that. And for me, you know me well enough to know that I'm really big on education and the education component of this, and I think that is paramount to changing perceptions, to changing the mindset, to understanding that people who have a different quality of life, just because it's different doesn't mean it's a lower quality of life. It's just different. We shouldn't make decisions based on that. And we could talk about this forever, but we're not going to.
Nope.
But look, I really, really appreciate you taking the time out of this busy conference where you're running the whole thing. So it's really important. I'm very thankful that you did this, and look forward to talking with you more and learning what's up your sleeve next time we chat.
Absolutely. Thank you again.